Hi, this is Arun Bangarappa. Today we're going to explore the Dr. Bharadwaj journey into homeopathy, his approach to treatment, and his insights into evolving landscapes of alternative medicines. We will delve into the challenges and the rewards of practicing homeopathy, discuss some of his memorable cases, and understand how he views on the present environmental health condition, especially in homeopathy. Join us, we uncover the unique perspective of Dr. Bharadwaj and learn about the impact of homeopathy on patient lives. Hi, sir.
Hi Arun.
Could you share your bit, your background and where were you born and what your educational background?
So I was born in Anantapur. It's a small town in Andhra Pradesh. There is a small hospital called by the name Meda Nursing Home. I was born there, and I was with my grandparents. My grandparents used to stay there, and my father and mother was living in some other small village. So I was sent here for education. There is one school by name LRG school. I studied there. I was going for LKG, and I never used to go to school. As soon as my grandfather drops me at the school, I used to jump the wall, or I still remember there is a small space between the gate and the floor. So I used to come out of that floor, and I used to enjoy outside, and I used to go to home after the school is over. So one day, someone was working in my grandfather's place, and he found me that I was roaming here and there in the Anantapur. So my grandparents came to know about that, and they sent me back to my parents. My parents decided that this village is not good, so my father was working in bank, and he transferred himself from that place to Madanpalli. It's a place in Chittoor district. There is a school by name Arogyamata English Medium School. I regularly meet my friends there even now. So I studied from LKG to 5th class. I have studied there. After that, my father got transferred to another place. The place name is Amarapuram. It's a small town within Anantapur. So I studied 6th, 7th, and 8th there. After that, we transferred to one more place, Kadiri. I studied in Sharda Vidya Mandir there. After 10th standard, I moved to Chittoor. I did my BPC, my intermediate studies there. After that, I took long term. Previously, they used to be MSET. I studied MSET in Nellore, Quora. After that, I got seat in homeopathy in Hyderabad, JSPS Medical College, and I completed my undergraduation there. After that, I developed interest in clinical research. So I went into clinical research. I did masters in clinical research. Basically, clinical research means when a new drug or device or any other surgical techniques before going into the public, there should be research on it. You might have heard during COVID,
Yes, sir.
clinical trials are going on. So I was an expert in that, and I was designing clinical trials. I have even designed some of the COVID vaccine trials when I was working. So I was there sometime in UK, and I worked in India as well. I have around 15 years of experience in homeopathy and around 10 years of experience in clinical research. This is my journey from childhood to till now.
It's a very interesting and so funny, sir.
Yeah.
What motive to pursue this career, especially in homeopathy? Whether your intention is to become a doctor in childhood, sir?
No, many people says I had a dream from childhood to become a doctor or an actor or something else, but I did not have all those.
Hmm.
I had one peculiar interest. I like life sciences.
Yes, sir.
Life sciences, anything to do with biology, I'm very intrigued by it.
Hmm.
Even from the very early childhood, what happened was there is a guy called David Attenborough.
Hmm.
So he is a naturalist in UK.
Yes, sir.
So my father used to show me his videos. In olden days, we used to have VCP or VCR, right? We used to
Yes,
put
sir.
cassettes into it.
Ah.
My father got 12 cassettes. All these are about human evolution.
Mhm.
So there is a series of biology called Life on Earth. It is, I think, 12 to 13 series. So I watched all those series with my father. From that time, even before that, I was interested in life sciences. How I can say my interest is, I used to go to small tanks and catch fish. I used to study the fish. I used to collect the snails, aquatic plants there, and I used to go with my friends for expeditions. Like I used to go, and we used to catch small birds and bring them to home. In the same way, I was very interested in snakes as well. We had a maid at our home. Her husband is a snake catcher. So whenever he catches the snakes, I used to cry that I want the snake. What he used to do is he used to remove the fangs of the cobras and give it to me. I used to play for 2 to 3 days, and we used to release it in the open. Take that away from the city, and we used to release it. So once what happened, he has given me the snake. I was playing with the snake for 1 or 2 days. After the snake got disappeared, we searched everywhere in the home, but we are not able to find. Finally, we are able to find in one table drawer. Previously, there was big tables and they used to have drawers, right? It went and settled there. So I have taken the snake, played for some time, and I have called that guy. And before releasing, he got some doubt and he checked the fan. Basically, he forgot to remove the fangs. I was been playing with the snake with the fangs for last 1 week. What could be the reason is he is a bit drunkard. So I thought that in that mode, he forgot to remove the fangs and he gave it to me. So anyhow, he did not bite me, but this was my experience. What I want to say is, since childhood, I was very intrigued with the life sciences, and also when I was in sixth standard, 10th class guys has dissection, right?
Yes, sir.
So I saw that dissection along with my great teachers, one of the great teachers. Since then, whenever I found a frog, I used to take it, reverse it, and cut it open, and I used to study the parts of the frog. Not only frog, I used to do with this lot of animals.
Yes,
So in that way, I am very interested in life sciences. After intermediate, after 10th standard, my father advised me to join MPC, take maths, and become some pilot or some military officer. I was also in mode of becoming that. So suddenly what happened, I recognized that when I was studying mathematics, I used to get the books from biology students and used to study it. After 1 year of studying maths, I decided that I'm not interested in it. I went to my father and said that I don't want this, I want to go to biology. So my father luckily accepted it. Again, I have started, I lost 1 year, and again I have started the BPC in intermediate. I have completed 2 years. After that, I got seat in homeopathy. I never want to become a doctor or anything. Whatever I do, I want to be in this life science. So the seat I got, after that, I have studied homeopathy. This is my journey.
Very interesting, sir.
Medical.
Especially a lot of the medical field is a very wide field actually. You can become a pediatrics, or you can prefer gynecologist. A lot of opportunities are there. But in spite of all those things, also you particularly, why did you choose the clinical research?
Right. So I had a habit of treating patients when I was in first year. First patient I treated was my friend's nephew. So what happened was, uh, one day I was in my room and I have suddenly received a call from my friend's nephew. He was saying that he had severe tooth pain, lot of redness, lot of swelling, lot of pain, lot of tenderness, and he has gone to all the dentists. It is not reducing. Can you help? So I know one of the senior guys. His name is Chakrapani, my senior, and he is very intelligent and talented doctor. So I told him to come. So they stay at Khairatabad in Hyderabad. I used to stay in Ramantapur. From Khairatabad, they came to Ramantapur. I called my senior. He told me to give a particular medicine. I still remember it. That is Belladonna 1 m. So I have given 3 doses of Belladonna 1 m in a span of 10 minutes each, and he left. By the time he goes to his Khairatabad place, it takes half an hour. By the time he went to his place, his pain is gone, his redness is gone, his swelling is gone. He went home and he slept. It is already 1 month he has slept. So with that, I understood that homeopathy is powerful. I treated it successfully. I was still a student at that time, second year student. I was been treating many cases like that when I was student. And suddenly what happened was, I had a senior by name Srikant. So he gave me a book one day. It's about allopathic pharmacology. Allopathic pharmacology, normally homeopathy doctors or alternative system doctors will study allopathic pharmacology as well. Along with our pharmacology, we study their pharmacology. When I was going through that book, I found that it's completely scientific. Means normally there are two kinds of things in pharmacology: pharmacokinetics and pharmacodynamics. Pharmacokinetics is how the medicine moves in the body, from where it is absorbed, how it is distributed in the body, how it is metabolized in the body, finally it has to be eliminated, right? Anything that goes in, it has to come out. So how is it eliminated? Complete picture is given. And also pharmacodynamics, what when the drug goes into the body, what it does. So when you have acid in your stomach, when you take antacid, it neutralizes it. So there will be a drug mechanism, both pharmacokinetics and pharmacodynamics clearly mentioned in that. But in homeopathy, it was not there. Homeopathy doctors, in even in colleges, they still study the books that are written long ago. So homeopathy was invented in 1796. At that time, what books are there? These guys still study those books. And stethoscope was invented in 1816. So the books that homeopathy doctors study are very old books. It is not updated. And also one more problem homeopathy has is about its dilution. Can you get the dilution? This is one of the important medicines or considered as backbone of homeopathy. Previously, it was thought by scientific community other than homeopathy that it doesn't contain medicine. It is just dummy drug or placebo. It doesn't have any medicine. That's the reason homeopathy is considered as a bogus system of medicine. So that's the reason I want to burst these myths. I want to establish pharmacokinetics, pharmacodynamics, and I want to know what exactly is in that medicine. That's the reason I have developed interest in clinical research. I did my master's or PG in clinical research, and I was working in various clinical research organizations as a clinical trial designer. I was there in UK for some time, and I came to India again. And all these times, even though I was in clinical research, I was continuously practicing homeopathy. I used to treat the patients even though when I am in UK or India. I used to treat the patients whenever regularly along with this clinical research.
You are actually earning well, sir, and you're already developed in medical research. And why did you again come back to the this homeopathic field?
Right. So it is an interesting question. The answer lies in 2010. What happened in 2010 was there was a research conducted by Professor Jayesh Ballare. He is professor in chemical engineering. He is from IIT Mumbai. So what he took the homeopathic dilution and he clearly established that with scientific proofs and with electron microscope, thus this contains nanoparticle. It is not some dummy drug. This contains nanoparticle. Even he has established the structure of the nanoparticle and also the concentration of nanoparticle. He established that every homeopathic dilution will have a ingredient in the center surrounded by lactose coat. On top of it, it will have a mesoporous silicon coat. This is considered as homeopathic nanoparticle. So this dilution contains those nanoparticles in very low quantities, and those nanoparticles has a biological activity, and the concentration of those nanoparticles also determined. It is determined that it is few hundred to few thousand picograms. So that's the reason everyone, not only the homeopathic doctors and also from the scientific community, has understood that homeopathy is not dummy. It is no more a false or bogus system of medicine. And also he has established with his colleagues that homeopathy works on the principle of hormesis. Hormesis is considered to be the pharmacodynamics of homeopathic medicines. So a lot of research has to be done, but there is a starting point that it is not dummy. It has biological activity. Is completely established by Professor Jayesh Ballare. After that, many people has done research. So some of them have sold their entire property. They went bankrupt and did research on homeopathy. There are great people, but there are still lot of research has to be done in from that perspective as well. As of now, homeopathy is considered as a evidence-based medicine. So evidence-based medicine means you have a problem, you take the report before homeopathic treatment, you get treated with homeopathy. After that, take one more report. It is clear that your disease is cured. So that's the reason till now we are calling as homeopathy as evidence-based medicine. With the advent of this 2010 research, it is established that homeopathy is completely scientific. It's no more a evidence-based medicine. It has all the proofs. It has pharmacodynamics, pharmacokinetics, and drug stability. All these are put into homeopathy, but there is still some research should be going on, and it is a long way to go ahead.
And in Hyderabad, we have seen a lot of homeopathy clinics. And what is the specialty of the your clinic, especially Fidicus Homeopathy?
Yeah, Fidicus Homeopathy, even though I was treating patients for very long time, So with the advent of new technology and new research in homeopathy, now I am confident that I can say to all my patients and any scientific community that homeopathy is completely scientific, and I want to take this to the masses. That's the reason we have established private limited company, Ingenious Private Limited. Under that we have Fidicus Homeopathy as a brand. The specialty of Fidicus Homeopathy is one thing. The topmost priority is you have highest chance of success here. What I mean by highest chance of success is compared to any other homeopathic clinic or individual doctor you have in the world, with Fidicus Homeopathy you have highest chance of success because of two reasons. One is we use top quality medicines available in this world for any given variety of medicine. Who is a top manufacturer? Who is the best manufacturer of that particular medicine? We import it or we take from them. And also whatever the doctors we have, you can see there. So all the doctors we have are qualified, knowledgeable, experienced, okay, competent, honest, passionate, and compassionate. So all our doctors who we take will stay with us for a long time, and only top doctors who are highly qualified, highly knowledgeable, highly skillful, we take those doctors. That's the reason our success rate, no one in homeopathic field has our success rate. We have highest success rate for any disease. This is our core principle. Other than that, we have three core. This is our main tagline. And coming to the core principles, we work on the three core principles. First one is highest success. I have already explained to you. The next one is transparent treatment. All the treatment you get is completely transparent. We don't have any fear that some people are afraid that if we tell all the truth, that the person may not take treatment from me. So we don't have that fear. We give complete black and white information to them. Whether the patient takes homeopathic treatment with us or not, it is unimportant to us. The important thing is we have to give them the transparent information, best information, correct information, and they have to take the decision. The reason is, see, homeopathy has pros and cons. There are advantages of homeopathy and disadvantages of homeopathy depending on the situation, depending on the age of the patient, depending on the disease, depending on the stage of the disease. All this considered, we give best advice and decision is left over to him. So we will not force anyone to take the treatment because we don't bother about it. Only thing we do is we give transparent information and the decision is given to the patient. And the final one is personal care. I have seen many patients, homeopathy patients, call to a corporate homeopathic hospital or individual doctor. So every time they go, they will find a new doctor there. They have to explain all the symptoms again and again, and they start the treatment from the beginning. With us, we have personal care. Even when you call us, all your mobile numbers or everything is recorded to us. Even before we answer your call, we know why you have called us, and also we know that your complete condition. Based on that, our staff, our medical staff or non-medical staff will be well equipped to greet you and to know everything about you before they talk to you. So we are using lot of technology for it, and we have blend the technology with the personal touch. So here you get personal care. So these are the three main core principles we have. That's the reason everyone should come and take treatment at Fidicus Homeopathy. Fidicus Homeopathy is the best place for them to take the treatment for any given disease, for any given gender, or at any stage of the disease.
So nowadays, your clinic is highlighted all over the Hyderabad. So why did you prefer only that Fidicus, the
Yeah.
name? What is exact the meaning of that Fidicus
Right.
that we want to know?
So Fidicus has a very great importance. One thing I found lost in this generation is, so when I used to see old movies or when I go to old doctors, everyone tell that now the doctor have no value. When we were young, the old doctors say doctor is considered as a god and that is lost. Even from my college days, I have found that there is lot of clash between patient and the doctor because there is no trust between the patient and the doctor. The trust is lost. So we want to bring that trust back with Fidicus Homeopathy. See, you can see all our principles: highest success, transparent treatment, and personal care. These are pointing towards the trust, right?
Mm.
Trust is very important. Normally, most of the medical words are taken from Latin. We also took that name from Latin. So, fiducius in Latin means trust. Medicus means doctor. So, fiducius and medicus, we combined these two and we made it at Fidicus Homeopathy. What exactly mean by Fidicus Homeopathy? The word combined in Latin is, so trust your doctor. Doctor should trust the patient and patient should trust the doctor, and the trust should be from both the ends. And also doctor should behave in such a way that the patient should trust him. He should never lose the trust of the patients because he should be honest, he should be transparent, he should be giving personal care, and he should be showing the highest regard for treating the patients. So basically, Fidicus means trust the doctor, or trust is the bond, the important bond we want to elicit between doctor and patient. So that's the reason we named it as Fidicus Homeopathy.
Very nice, sir. What type of the special treatment does your clinic offer for different kind of diseases, or especially complex, very rare diseases?
Right. We are different type of services.
Yeah.
First one is categorizing the diseases into three types. One is acute diseases and chronic diseases. Acute diseases means the diseases that start suddenly and you need quick relief for them. It is again divided into two: acute emergencies and acute non-emergencies. Acute emergencies are the ones like heart attack, needs quick attention but it's dangerous, or brain stroke needs quick attention, it is also dangerous. In this regard, acute emergencies, we consider them as our secondary priority, not our first priority. Whenever the patient comes with these kind of diseases, we ask them to go to allopathic treatment and consider homeopathy as secondary treatment, because it is not that homeopathy is not effective in this regard, but there is more research need to be done in this area. That's the reason we consider homeopathy as secondary line of treatment in acute emergencies. Other than this, when you consider acute non-emergencies, like you have high fever, anything else, you have vomiting, bartholinsis, women come with high vaginal pain. So any acute disease which is not emergency will be taken care by us, and we give the relief very quickly in shorter period of time. That's the reason we give services for acute non-emergencies as well, because homeopathy works very quickly with at Fidicus Homeopathy. Apart from this, as you know, homeopathy is famous for chronic diseases. We treat all kind of chronic diseases like diabetes, thyroid, or any obesity, any chronic diseases we are able to handle very well with highest success. And coming to the second type of category, one is common diseases and complex diseases. A cold is a common disease, simple disease, so it's very easy to treat. And brain tumors, cancers, these are all very complex diseases. We treat both simple diseases and also complex diseases like brain tumors and cancers. This is one category. One more category is common diseases and very rare diseases. For example, cold is a common disease, everyone will get it. And some of the rare diseases like SSP, subacute sclerosing panencephalitis, and Creutzfeldt-Jakob disease, Duchenne muscular dystrophy. These are very rare diseases. We treat those diseases as well at Fidicus Homeopathy. So these are the various kinds of diseases, and we offer two types of consultation. First one is in-person consultation. We have a lot of clinics located at different locations. So you can just call us and you can directly visit the nearest clinic to you, or else wherever you are in this world. We offer you online consultation. You can talk to us either in audio call or video call, and if any investigations are required, we will ask you to do at your place and send it to us electronically. Based on that, we will select the medicines and send the medicines to you within couple of days. Within India, you will get the medicine within 2 or 3 days. Other than this, any place in entire world, you will get within 5 to 6 days. So for to US, we are able to ship within 4 days. Some other countries will be taking 5 to 6 days. We are covering entire world. We even have the patients in Pakistan. We are treating the patients in Pakistan as well. So we are covering entire globe with our online treatment.
You are basically originated from Anantapura, and you are already specialized in the clinical research. So, along with your confidence in this domain, so what are your future aspirations?
Yeah, future aspirations are simple. There are only two things we want to do. First one is, as I said, lot of research has to be done in homeopathy, particularly in acute emergencies like heart attacks or brain tumors. It doesn't mean that homeopathy doesn't work there. It as of now it works well. It works better than any other system of medicine, but still there is some research need to be done so that we can take that to the masses. So I want to involve in the research where homeopathy takes care of acute emergencies like heart attacks and brain tumors. This is one part. And next one is, you can see homeopathy clinics or corporate chain of clinics, but we have the inpatient. We can get the patient and admit in the hospital, but it is not available to everyone. So we want to venture into that. We want to have hospitals, not only clinic, very big hospitals for homeopathic inpatients. The patient can come and admit, and they can take the treatment as an in person and get cured. So we want to venture into those two things. So our immediate action will be how to apply homeopathic medicines for acute emergencies, and to go with the bigger hospitals, inpatient hospitals. We can admit the patients as allopathic hospitals do. So we are planning for that.
What about your special advice for the upcoming generation, those who wants to take homeopathy?
Right. Those who wants to take the homeopathy has to remember one thing. There are few reasons why all the new generation has to come consider homeopathy. Homeopathy is the only system of medicines where there are no side effects, and the medicines are very effective, and the medicines are timely. So with homeopathic medicines, you can prevent a disease, you can cure a disease, and you can give relief if you are not able to cure. Considering all this, homeopathy is the future of medicine. So you will be seeing a lot of research in homeopathy, and it will be taken to the masses. So that's the reason everyone should consider homeopathy. Whoever is passionate about life sciences or medical sciences should go with homeopathy as their primary option, not as their secondary option.
Thank you for your valuable information.